Hello everyone, welcome back to Grow Med. This is a short, quick revision video of a very important topic from the ophthalmology, that is the keratitis. So we will be discussing what do you mean by the keratitis and its types, and also the type of questions asked in the Fmge. Okay, so keratitis, it is the inflammation of the cornea. So it is characterized by corneal edema or infiltration of inflammatory cells and ciliary congestion. So this keratitis, it presents with the features like pain, redness and discharge. The types of the keratitis are based on the causative organism: bacterial, viral, fungal or protozoal. Okay, so the risk factor for the bacterial are usage of the contact lens and dry eyes aberration. Okay, then causative organism is the Staph aureus and another important cause is the Pseudomonas. Then the clinical features include the hypopyon corneal ulcer. As you can see here in this image, the ulcer is forming a hypopyon. So this is a classical finding seen in the bacterial keratitis. So if a clinical case is given, it will be described that pain, redness and discharge. So these features, these are common with all the keratitis. But in question there can be some buzzwords present by which you can come to know that what kind of keratitis the examiner is trying to ask. Like for example, if it is bacterial, then there can be given a hint in the question like contact lens, or they can also be given in hint like hypopyon corneal ulcer, and image also can be given. So image based question can also be asked. So by this, if they ask you to make the diagnosis, then it will be bacterial keratitis, and if they ask for the treatment, then it will be fourth generation fluoroquinolones. Then moving on to the viral. So the risk factor for development of viral keratitis is history of cold sores, and cause is the HSV1. Then clinical feature is the dendritic ulcer. So this is very important question, and this one is asked where multiple times. So it is a PYQ, the dendritic ulcer. So as you can see here in the image, this is the dendritic ulcer. Image based question is also asked, giving the image, and the question asked was the following ulcer is seen in which kind of keratitis? So the answer was viral keratitis. Or simple one liner was also asked that dendritic ulcer is associated with which of the following keratitis, and it is the viral keratitis. So it has three stages: epithelial, stromal and endothelial, and treatment we will be using antiviral drug, that is the acyclovir. So if a clinical case is asked on the viral keratitis, then features will be described. The same features will be described, and they can give some hint in the question like dendritic ulcer or causative organism is the HSV, like that. Okay. Then moving on to fungal keratitis. So the risk factor is the trauma or the vegetative matter. So this one is also a PYQ, and this one is also a piece of a cake. Okay. So in the question, if they give vegetative matter and describe the features like pain, redness, discharge, then think in terms of the fungal keratitis. The causative organism is the filamentous fungi and the aspergillus, and clinical feature, the classical feature seen with this type is the finger-like projection having feathery margins. As you can see here in the image, this type of ulcer is classically seen with the fungal keratitis. So image is also important because image based question can be asked, and the pattern of the question can be like giving the image, and this type of ulcer is seen in which of the following keratitis, or they can describe a case that a farmer was there, a farmer, then he had come in contact with the vegetative matter like something leaf something, and then after that he will develop dryness in the eyes, then pain, and on examination his eye finding was this. So which of the following is the diagnosis? So it will be fungal keratitis. How do you treat this patient? We will be using natamycin 5%, amphotericin B or voniconazole. So these all are the antifungal drugs, and we will be usually treating the patient with the antifungal drugs. Then moving on, protozoa. So the risk factor for development of protozoa keratitis is um, contact lens wear. So this kind of keratitis is also called as acanthamoeba keratitis, because the contact lens wear is most commonly associated with the acanthamoeba. And this was also a PYQ, that contact lens wearer, these people are at risk of developing which of the following? So it is acanthamoeba keratitis. And another risk factor is the poor hygiene. And some people who are contact lens wearers, they also share their contact lenses, so that is also a risk factor for development of this acanthamoeba. The classical feature seen in this is the ring shaped ulcer, as you can see here in the image, the ring shaped ulcer. And also radial keratoneuritis can be seen in this. The treatment is by using PHMB, the full form polyhexamethylene biguanide, and along with that we can also use other drugs like chlorhexidine propamide. So this acanthamoeba and the contact lens wear, it is a very important question and a very famous question. So this was a quick review video on the keratitis. You need to look at the images, then also the buzzwords like the corneal ulcer, hypophion, then the dendritic ulcer, ring shaped ulcer, contact lens wear, okay, all these things, because these things will help you in cracking the question if at all a clinical case is given. That's all in this video. Thank you so much for watching this video. If you're new to GrowMed, subscribe to GrowMed, like the video, share it with your friends. Bye bye. Thank you so much.